Hello wonderful people, Dr. Sill here, Junior Doctor from Sydney, Australia, and it's time for another episode of Dr. Sill's Intern Diaries, where I grab myself a cup of tea and I reflect on what it's like to be a junior doctor in Sydney, Australia. And just to kind of get a chronicle of the experiences that I've had. And hopefully it might be interesting to some of you who may be medical students or people interested in healthcare or other junior doctors to compare experiences, because no two experiences are the same, that's for sure. But in this video, we're going to talk about a couple of things. We're going to talk about a surgery that I saw the other day and how that moved me. We'll talk a bit about this dichotomy of being an expert in the EMR, the electronic medical record, versus being a doctor, because I think those are two different skills, and as an intern we spend a lot of time on the former. And finally I'll talk a bit about my career plans from now, and also a little bit about how the after hours shifts have been going. So let's get started. So the other day there was a patient that came in after being thrown off the back of a horse, and an old guy, 74, but didn't have any osteoporosis, good bones, but when he fell he cracked not all, but a lot of his ribs on the right side on his back, the posterior aspect of the ribs, and they even went under the scapula, that bone that covers the ribs on the back. So it's pretty nasty, and he basically was just in severe pain for a really long, for more than a week, and the pain wasn't getting better. So the decision was made to fix the ribs, to basically perform an operation where you cut the skin, open it up and expose the ribs, and then grab a piece of metal and connect the ribs so that they act as one rib. So you would do this on a bone if you broke your arm as well. You can get surgery to line them up. The problem with ribs though, compared to the arm, is the arm you can put in the cast, and so that immobilizes it externally, and so you don't need an operation. But the ribs, you can't put a cast on your ribs. You can't stop breathing. So that means every time you take a breath, the two broken ends of bone are going to rub, and that is excruciatingly painful. It is awful. I feel very sorry for anyone who's ever had a broken rib. So the decision for the surgery was made, and the patient consented and agreed, and the operation proceeded. So with the rib fixation, the consultants actually let me get really involved because it was my last week and they were happy with the work I had been doing, and they wanted to show me a bit about what they did, and I got to do a number of things. I got to make the incision for where a chest drain was going to be placed, and they let me screw in the plates that will hold the ribs together, and it was just such a beautiful experience. I really envy surgery. I would love to be a surgeon. This thing that you do to someone is a beautiful thing. Someone is basically putting their life and trust into your hands for you to fix a problem. And it's a significant problem, and it's significantly complex, but you've done so much training and dedication that you are able to essentially address this issue that few other people could address. And that's just magnificent. That's really cool. And it's such a tactile and personal experience, you know. It's never like the same thing twice, because everybody is different, and the anatomy is beautiful, and body is it's an orchestra of incredible scientific phenomena. It's just awesome. I love surgery, but my gosh, it's the price you have to pay to become a surgeon is unacceptable to me. What you have to give up to become a surgeon, I would never be willing to give up. And so I had a bit of an existential crisis after the procedure, because I was like, damn, maybe this is kind of the last time I can decide to be a surgeon. After this year, after next year, I'll never kind of get another opportunity at getting onto a surgical training program. So I have to decide pretty soon whether I would ever be a surgeon. And although it's such a beautiful thing to me, it's not something I'm going to do. And it's because the price is so high, right? You have to give up so much of your life. So many trainees that I've met, people on the surgical program, they are delaying their relationships. They're not getting involved with people. They're losing their health because they're focusing so much on work, and they're stressed. And you know what? The other thing is, I haven't met that many surgeons that just strongly recommend being a surgeon, because I'm not sure there's actually that many jobs available, because there's so many kind of trainees and medical students, and it's such a competitive field, and the college trains you up but doesn't necessarily get you a position or a job. So there's a lot of kind of technical things that don't actually seem that appealing, that make it not as appealing to me. So yeah, that was my little existential crisis. But I'm glad I've come to a conclusion that simplifies my life at least a little bit, which is I won't be a surgeon. The next thing I wanted to reflect on is this kind of experience of basically not being a doctor, but being an EMR professional. Like as the intern, often when the team is doing rounds, you're the one documenting and ordering tests and ordering medications and prescribing. That all involves like a high level of technical ability with the electronic medical record. Because I work in a hospital that uses an electronic system. That's great. It's really effective. We can do way more things. We can see information about patients from across the hospital. We don't have to go see the paper charts to see the medications and that kind of thing. There's no handwriting issues because doctors have really messy handwriting. We can do a lot more with EMR, and I'm absolutely certain that EMR is a fantastic thing. But the issue is when we're interacting with patients, I'm typing at a computer. I'm not actually looking the patient in the eye and connecting and being a doctor with the patient. I'm being a kind of administrative facilitator. And yes, I'm learning about all the medical stuff, and I'm learning like I have to order this type of scan when you have this type of problem, and that's important information for doctors to know. But I'm not getting the kind of experiential aspect of that. It's more a kind of separate aspect. And so that's a bit sad. So as I noticed that, I started asking my registrars if I could do more of the exams, which they were so happy for me to do. So I'm kind of like, I wish I had thought to ask this earlier. And the reason I hadn't is because it was easier the other way. It's not easy to do the patient exams, and I'm good at the EMR. Like I know my way around pretty well, and I'm quick, and I'm a quick typer, so I was doing what's easiest. But you can't always do what's easiest. I want to be a good doctor, and so I'm kind of forcing myself to do more patient reviews. The next thing I wanted to talk about was my career plans at this stage. Before I do, I just wanted to make a little plug. I've opened up a Patreon account, and if you ever wanted to touch base and do a kind of meet and greet call, I'm doing a meet and greet call for the first 25 patrons. So you can check that out. There's a link in the description, and all the support, like even just subscribing to the channel, I really appreciate it. So leaving the video a like, even just watching the video, I'm just very grateful for your attention essentially, and this kind of electronic relationship we have. So don't feel any pressure, but if you'd like to kind of do a call, that's one way to do it. So yeah, my career plans. I was thinking about entering the psychiatry training program next year, and I have spoken to about 7 registrars and maybe like 5 to 6 consultant psychiatrists. I've also spoken to other doctors that work with psychiatrists and also administrators. So I spoke to the JMO manager, and actually that was one of the most helpful conversations, because a JMO manager, the administrator, is the person that orchestrates and organizes all the different doctors. So they have a really good understanding of all the different pathways doctors go through, understanding the stress and the requirements that different doctors have, and that kind of thing. So yeah, I was thinking about just going straight into the training program after my first year of being an intern, but I've decided not to. At least I think I've decided not to. I'm pretty sure I won't. I think I'm at least going to complete my residency year, and that way, if I ever wanted to do another training program after psychiatry, I don't have to kind of redo my residency year to get on that program. So it just keeps my options more open as a first point. And the second point is, what's the rush, right? Like, I don't have to just rush into a program and become a consultant ASAP. I do have a bit of sense of pressure because there's so many medical students and, less and less training positions and that kind of thing. So I do have that sense of pressure. But at the end of the day, a couple of years difference in my career won't make a big change, really. And the third point is, I don't feel like I'd be ready to. Like, I'm definitely not cognitively at a registrar level. I don't know how to manage some basic things automatically. I have to look it all up, and that's okay. Like, it's fine. But if I want to be a registrar, I at least want to have a bit more proficiency. And doing after hours shifts has actually really helped with that, because you see so many different things and you have to solve so many different problems. But man, after hours shifts they just do, because of how long they are and when they are. So as the final thing I want to talk about in this reflection is how I've been going with the after hours shifts. So you might have seen some of my other Intern Diaries videos in the playlist. I really struggled at first. My first after hours shift was a 14-hour Saturday shift, and I didn't eat at all the whole day. I hardly drank. It was just horrendous. But now I'm getting way better at chilling out, because so many things are not urgent. Like, I thought everything was urgent because I just wanted to do everything and get it done. But now I can see what's important, what's not important, and know when to take a break. And yes, maybe someone will have to wait an extra 10, 20 minutes before, I don't know, a medication is changed or something, but they're not going to die and it's not going to cause any major problems, and they're probably not even going to remember it. But yeah, I did a shift a week ago and it just went much better. Like, it's long, 14, 15 hours. You get, it's exhausting, but I was able to do it. I was also able to do it while eating well and having a couple of breaks, just short ones, but enough to kind of feel reset. And then I did it. Like, the level of stress I had at the end of the day was significantly different. And that was just thanks to experience, I guess. It's not something you can really advise for. All right, guys, that's it for this video. I hope you enjoyed it. If you did, or you want us to get in touch, leave a comment below, and you can leave the video a like, which helps my channel grow. You can subscribe if you haven't. And other than that, I just wish you an absolutely lovely day. All right, guys, bye for now.